Innovation and creativity are central to entrepreneurship. But what happens when you go beyond the edge? The Frontier Entrepreneurship Podcast brings you the world's first, the disruptive, the avant-garde. We take you to the frontier in conversation with the entrepreneurs who are the forerunners of the industries of the future. Get to know their world with co-hosts Braden, Kemp, and Tracy Morningstar. Is it possible for cancer patients to avoid unnecessary trips to the hospital if armed with the right medical technologies? Clinical studies show that half of those visits to the emergency department were preventable. The healthcare system is stressed. It's challenged on multiple fronts. The demand for innovation has never been greater. Today, we take you to the frontier of the digital health industry with William Jones, Managing Director and Founder of Leynek Medical.
I'm Braden Kemp here with my co-host Tracy Morningstar, and today we're taking you to the frontier with Will Jones, engineer, MBA, and founder of Leynek Medical. Will, welcome.
Thanks so much for having me, guys. Really appreciate it.
Yeah, absolutely. We're excited to chat. Usually we start with a little bit of background, but I wanted to jump right in on something because we spoke before, and I remember you had a stat that surprised me. And correct me if I get this wrong, but clinical studies showing more than half of ER visits by cancer patients were perhaps preventable. Is that something that rings a bell?
Yeah. So that's that's a study I read. It came out in 2023. So even throughout the COVID timeframe, it covered, and it was in the U.S., but similar stats cover Canada as well. And it's 51.6% of patients. Those that cohort visiting the ER, 51.6% are deemed potentially preventable visits based on 10 diagnosis codes that come as a result of leaving the ER. So you visit an ER, you're diagnosed by the ER physician as having X, Y, or Z, and then the study showed that of those X, Y, and Zs, 51.6% of patients probably didn't need to go to the ER.
Wow. And you're developing at Leynek, you're developing a device that aims to help reduce those unnecessary visits, among other things.
Yeah, that's the goal. Will we achieve all 51%? That might be a tough feat to capture, but the overall goal is to help patients manage their symptoms. That's the end story. And so as you're going through cancer, it's an extremely uncertain diagnosis, and that's a broad term to use, right? Because very different cancers are very different. However, at the end of the day, you're given a very scary diagnosis, and then going through that uncertain time and going through the treatments, you might feel off in different ways. And what's the threshold for when you go to the ER or not, right? It's all subjective. And it's the same for you and me. If we fall and hurt our arm, it's sort of subjective on what you think, whether I should go to the ER or not. And so the goal is to provide a device and an app and system overall that you can use to better guide your care and help inform whether you should seek further attention. But even before then, maybe there's some great resources that are out there that will help be able to guide you and to manage that pain or manage whatever symptoms you're experiencing.
Yeah, that's fantastic, and beyond just the reduction of unnecessary visits to the ER, the human perspective of that is pretty important too, I think.
Yeah, Braden, you hit a great point there. A key point of that too is also the caregiving side, right? So you can imagine as a caregiver, you see your loved one, you maybe not living with them, so you see them once a week or once every few days. And just trying to get a baseline of where they are on a constant basis. That's what we're trying to achieve too, is giving caregivers insight so that they can help that patient through their journey as well.
When you're talking, there's so many things that go through your mind as to the impact and how it affects you and your family. But I think my question stems from, your own experience that you had, because we all always seem to kind of know ourselves better. So how does that impact the product that you're producing?
Tracy, for me, I started this company and it had a direction. And then my mom was very sick. She had cancer for 2 years and 2 different types of cancer. And one was a very rare and very aggressive form of it. And in that time frame of her getting the diagnosis, I moved to Ottawa, 6 hours away. And it was just tough to understand what she was going through and seeing how she was progressing and so forth. And so this year in 2023, things got worse. And it wasn't known until it was an emergency situation where that had to get taken care of. And then from there was just sort of a constant decline and constant effort working with all my brothers and aunts and uncles and trying to figure out what's the best way to care for her given her current state. And when I would go down to visit every week or 2 weeks from that 6-hour drive, I would go and see that, she was in a different state than what others were telling me. And I really started to see that there's a great way to place the product that I actually was starting to create and have it used by her so that people would be baseline better on what level of care she needs. And, selfishly for me, I'd get a better sense of how my mom was doing other than just getting a few texts or phone calls. Because you can kind of mask things as a patient if you don't want others to know. And so, we never got to the point where I could use it with her. However, a lot of what she went through and what I went through with caring for her was inspired into the design that we have today.
Is there a part of your product, Will, and I guess we probably should get around to describing a little more clearly what that is, but is there a part of that information can be shared with, like you say, with family, or is it just with the care team? Does the patient themselves have access to it for baselining?
Yep. So all the above. So we're still in the early stage of development. We do have a fully functional unit and quite a few more on the way to further guide some testing. However, interacting with the care team is important, right? Let's try and get insight to them to manage patients from home, especially those chronic care patients, whether it's cancer or even there's some other areas as well where there's opportunity to do so. And a lot of this is also done similarly right now with a multitude of devices. However, when you think of people who are 65 plus going through this uncertain time in their life, for them to use all of these devices every day, it can be overwhelming. So our device is sort of one that will be able to capture everything that we need in order to educate the care team on how they're doing. We are looking at opportunities to share with caregivers in a very easy to use, friendly way to say, maybe Braden, I want you to see this amount of info, and Tracy, I want you to see a bit more detail because you're the one who's really taking care of me, but I still want Braden to be in the loop on how things are going, so we want to really respect people's privacy and give them that opportunity to share what they want with who they want. And then with themselves as well. Yeah. So that'll be the goal, right? Is to be able to use it, get a sense of how you're doing on a daily basis and trending throughout that period. And so, when you go to speak to your specialist 4 weeks away or even 3 months away, you're going there and instead of just having a snapshot of how does Braden feel today? Well, I feel pretty good. I had something about 2 weeks ago. I can't really remember. Often we as patients ramble on about how we felt or what went on, and then nothing is really action from that. And so to be able to sort of quickly show a nice overview of everything that's happened over that period that we've since last talked will be a very beneficial tool for the patient to use in their interactions with their specialists.
And to follow that, maybe back to the start, can you give us the intro on Leynek and on the initial device you're developing?
Sure. So Leynek started from an idea. My daughter got sick and she she had to go to the ER, and it was sort of a 5-year-old with a fever, pretty standard protocol once you're 5 years in. And so I've been monitoring her for a few days. And then after day 3, I decided to go to the local hospital because we didn't have a family doctor. And I didn't want to go to the walk-in clinic, and they had a special clinic at the hospital. There's 250 people that we passed in the hallway, and then a nurse and a doctor saw her, and it was all great. We're very thankful for the care, but at the same time, I was just thinking it seems sort of silly with what was done and why that can't be done from the comfort of our home or wherever we might be. And so I ordered a few parts, stethoscope and a few other parts, and started to cut it up and put it all together, and started to do a little bit of coding. And then I realized, like, hey, this can actually work. There's something here. And then I started to add a few different things to one, to it all just on one device. And it made me see that there's a great opportunity here to minimize the amount of devices that are used out there in the world. And so pairing that with a mobile app, it just makes sense because that's where we live these days. And from there, I just continued down the clinical path of understanding what the use cases were, and really understanding the workflow of care teams and patients and where this could be useful.
Sounds like an engineer tinkering with technology, which is awesome. That's my favorite type of entrepreneurship.
You know how the Apple Watch, I have it, I have the heart monitor thing and all that sort of stuff, but I don't always understand what that is. I'm not really getting what level of health am I in. The app that you have, does it do a little bit more in allowing the person to really navigate where they're at?
Yeah, it's a great question, because I think a lot of we're inundated with data, right? And if you told me my heart rate is 75, it's sort of like, okay, that seems a bit higher, but situationally, I just walked down to the washroom and walked upstairs to come back to this booth to talk to you guys. So, that's not bad. And so I think what's missing is the context. And, from the physicians I spoke to, a lot of, it's great to get data, but a lot of the data is just without context. It's sort of, what do I do with it? That seems bad, or I should find out more. And so the goal is really to empower the patient to understand that data, and not just understand that data, but then to have resources tied to it. So, say, Tracy, if your blood pressure is in the 65 to 70 range, here's how you can manage it in different ways, right? And I think that's the key part of this, is to help sort of offload some things off of the care team, onboard it onto the patient. And there's a lot of great resources already out there that a lot of nonprofits create with those respective disease states, right? So let's say for cancer, one of the largest cancer nonprofits in Canada organizes all these great resources. Same with the largest heart disease foundation, right? But you as a patient, using an Apple Watch, seeing that you're 60, et cetera, you then have to go search that out, find the right one, et cetera, right? So the goal will be to help patients not only understand their data, hey, this is probably not a great data point for you. Here's a way to help guide you to a more stable path.
Does a doctor or a care team have to look at this data and ingest it all to make some sort of a determination, or can the technology help to flag things for them up front?
Excellent question. I can't go into too much detail because I have some ideas that I want to implement in the future that there might be some ideas there. However, let's stick to where the world is going and where things are at, right? Braden, do you have to digest all of this? Does it make sense to present you with a PDF of how to manage your heart rate? Probably not. Maybe there's a way to interact with you remotely in a way that is automated to help guide you based on a series of questions, right? So there's different things you can do to help entice the user to stay in the app, but then also give them benefit of having that interaction to learn the content rather than go read on your own and figure this out, right? So there's definitely some applications that we're looking at, both on the sort of automating does a care team really need to go in and dig in on these numbers? And then also from the patient perspective of sort of digesting the guidance. Maybe there's different unique ways you can apply how they can be educated to guide them through that path.
You talked about your partnerships and developing partnerships. Is the partnerships that you're looking for in the future going to be part of that expansion, or that, where you want to go to down the road as to, is it going to be the final product, or is this going to be like 1.6 type thing?
So big vision to grow this company larger. And it all starts with having a strong go-to-market with the first product. That's why we're being focused on oncology. That way it's a space that there's tons of devices in cardiology. There's tons of devices and apps in mental health. Oncology is a nascent field for these types of devices to help improve patient care. And with partnerships, we're looking to partner with nonprofits, with hospital researchers on both of those fronts, because they are key partners. However, early on, probably the past 8 months has all been about partnering with the right ecosystems, innovation ecosystems like NCFDC. I'm part of Invest Ottawa, different groups like that really encourage and educate on how to build a business and how to narrow down a problem to really define the problem and then help develop your MVP. And so a lot of the stages of partnership are about sort of business and entrepreneurship early on. And now we're moving towards clinical partnership, validation partnerships, and then also with people channels that will be able to reach a broader audience. So through the nonprofits, et cetera. And then as we go forward into the company, maybe 3 years from now, 5 years from now, maybe there's ways to license out certain parts of the products in different ways to branch with other companies that are doing sort of parallel paths where we see mutual benefit. That's further down, but that's sort of how I approach partnerships from a startup perspective and going down that 5-year plan.
You mentioned early there that a strong go-to-market is key to getting this company and the device off the ground. The medical industry in general is almost completely outside my wheelhouse. So can I ask, what's the path to take a medical device to market? Who's the buyer? How does the product ultimately get to the patient? What does that look like?
It's typically longer, and that's why there's Canada, we're starting to get a lot better. We're still net importers of our medical technology rather than exporters, despite all the phenomenal education and people and talent that we have in Canada. I've been in this space since 2013 when I met a physician who was trying to help educate other scientists and clinicians to commercialize their ideas, that it's actually a net benefit for society to do so. And it can be a long journey. So, what's tough is when you stack it up against some of those investors that are looking for that 7-year turnaround, that can be tough, right? Because it's a long journey to not only just get to market, but then to drive traction. So typically, the path we're going to take is through a 510K, which is a pretty low bar from a overall perspective. However, it still takes a fair amount of quality documentation, et cetera, to be able to get to that point. So it's interesting because a lot of companies, especially startups and medtech, take a few years to get their 510K. I'm being very aggressive, and I think that's due to, in part, a lot of my background. I've had 3 years at a medical device startup, 3 years at a mid-sized company, or 4 years at a mid-sized company, and then a year or so at a Fortune 500, all in medtech. And so I've done the engineering testing for a 510K. I've done the project management around a 510K. I've done the commercialization aspect in the US, in Canada, in Japan, and in Europe for a medical device. So I have very ambitious goals to have shorter timelines. However, it it takes time. So once you do get that 510K, then you can go to different hospitals and start to speak to them. In Canada, it's through the medical device license, the MDL. Who's the buyer in this? So we're going to be looking at getting 1 or 2 hospitals on board in the US first. That's our goal. And then once you get those, you can sort of take that and work with a team that wants to do some research on it as well and write a paper. That way you can take those results and go to your next sort of, let's call it client, and say, here's what we did here and here's where we saw the benefit. Now let's take this and go to the next group. And eventually you want to look at, in our case, you want to look at broader things like health plans and insurance companies, et cetera. Can you imagine keeping, it's a different model in the US, but imagine keeping certain patients out of the hospital if they need to go, right? Think of that 51.6% that we've started off the conversation with. If they didn't have to go, think of how much money would be saved for those companies. And then further, of the commercially insured population, a cancer patient will visit an ER about 2 to 3 times per year.
Yeah, I mean it's kind of complex, I guess, is is the really short way to put it. But you know what, your background in understanding that regulatory, I think, is a huge advantage. I do a little bit of work in the agri-tech sector, and it's similarly a lot of regulatory hurdles to clear before you can get products into the market, and that has been the undoing of many ag tech startups, is not understanding that regulatory piece. So I think you got a bit of a leg up there.
Yeah, and it's easy as a startup to spend money where you don't need to spend money and spend time where you don't need to spend time. And if you don't have sort of that right guidance of where you need to go. And I've had great advisors through different incubation programs, et cetera, and just through my network. So I don't have a formal, say, advisory board, but I think I talk to some people, some advisors, maybe like 2 to 3 times a week, just, hey, here's sort of what I'm thinking. What do you think? So as much experience as I have, I rely a lot on others. And we actually just brought on a phenomenal resource. He's our new CTO, and he's built a startup before. He's got even deeper knowledge than I do on the engineering side there, Braden. So he's just been a phenomenal resource to have on board. And having these people are key to helping grow the company and to your point, get there faster than running out of money and hitting these hurdles for regulatory quality, et cetera.
Yeah, it's great to hear.
Yeah, I appreciate that conversation, because I was going to bring up mentorship and how it's impacted and having them provide the knowledge, having them, if there's issues or anything that might arise, they'll provide that input and allow you to move along at the pace. It sounds like you're going to be moving at a pretty fast pace. But yeah, mentorship is a huge when it comes to entrepreneurship, for sure.
Yeah. And, a lot of times you're wondering if you're making the right decision, right? And I don't know if you guys have experienced this, Tracy. I know, like, sometimes I like to think I'm fairly educated and I'm like fairly experienced, and I go, is this the right decision? And having people that even just to hear you and bounce ideas off just helps keep you on the right path and keep you, your bucket full on keep going. You're making the right decisions. Keep going.
Isn't that the whole challenge of being an entrepreneur? Like, what am I doing here? And do I know what I'm doing?
It's a constant question. And you can't get too hard on yourself at times. I've made a few mistakes in this. I incorporated it in January, so I've made a few, like 1 or 2 mistakes during that path. You just hope that it's not too much money or time. You just keep going from there.
Yeah, absolutely. Is there a broader vision here? You mentioned, you see the opportunity to build a big company here in Canada. Is there a broader vision to help enable better virtual care? Is that part of this strategy? I read virtual medical care increased by something like 50 times in 2020 with COVID and remains considerably higher. Like, I imagine there's opportunities in that space for hardware devices.
Yeah, excellent. I'm not going to pretend that I know the entire complexity of the healthcare system and say that I can solve all problems. However, even with the staffing shortage we see, and it's the same thing in the U.S. with family physicians being short on staff and whatnot. And there's a place for just virtual care like we're doing right now, just a phone call like this. But then there's a place for having hardware out there that can help add more value. And I think there is hardware out there. There is hardware out there. I think what's missing is that we don't just need more data. We need something that's going to be a companion and guide someone through that journey, especially with the chronic care. The more acute settings where you're interacting with a family physician or those one-off sort of calls, maybe that is just a device where you get a bit of data. But it's really about these disease states being a journey, and not everyone's journey ends up in a good story. Like life is tough, and some paths go the wrong way, or the undesired way. However, some can go in a better way, and it really depends on how you manage yourself through that journey. And even for those that don't end with the high note, do everything you can to make sure that you enjoy the most during that path, right? So when you're dealing with these very complex and chronic conditions, you have to know that some patients are, the stats show that they're going to pass away. However, as a company, if we can help improve the lives of the caregivers or the patients during that life that they do have, to me, that's very meaningful. And just having seen that with my mom and trying to do everything you can to enjoy sort of every day, I think that's really impactful. And I think there's a huge place for, I remember when my mom got sick the one day, and I tried to call the hotline and it just went nowhere. Right. And you end up so frustrated because you're like, well, this is the conduit. Like, what do I do if this conduit doesn't work? Right. And having some sort of feedback with the hardware device and paired with the app, and knowing, things will get looked at in different ways, or you'll get guidance through that. I think that's very impactful for the, not just to the patient, but to the care team, the caregivers as well, throughout that journey. So I think there's a huge open space for hardware to fit into this virtual care discussion.
It's awesome to hear that really compassionate human perspective from, I think, what people sometimes see as the big bad medical industry, right? And just out after our dollars or whatever you hear. But no, it's good to hear that side of the story as well.
Yeah, Braden, to that point, I think it's really important. We do have a patient first is the focus. Like, that is what I learned at one of the companies I worked at. Patient first. So if the design, it's a core value that's in the company, and it goes right into the design. And so if you don't have that mentality, then you're going to be out for a quick buck. But if you have that mentality, you're going to do everything you can to design something for the patient first and go from there. That said, you still need to make money to make different products and continually iterate and improve the product, right? So that's where we look to drive this business, is to improve not only this product as we go forward, but then also add other products down the line.
Yeah, fantastic. Tracy, anything else for Will before we wrap it up?
I was just going to mention that we always talk to entrepreneurs, and they always talk about an extreme sport, and moving from a paid job into being reliant on now what you're able to bring in as your business progresses, especially as a startup.
I always wanted to be an entrepreneur. I actually tried to start a company back in 2018 or so. Didn't really go anywhere because I got hung up on the name, right? And I was focused on the wrong things because I spent 2 months just sort of spinning the wheels on the name, whereas this time got there a lot faster. And 3 or 4 months in, after quitting my job and doing this, I was a bit, I'm in my attic for 4 months straight. Like, what is this the right decision with a 5-year-old as well? And my wife was on board with it and everything. However, after that, I got my first angel investor, and I didn't even show him my product or talk. He just believed in me, and he just said, yeah, let's here's a certain amount to get going. And then I applied and got in with the thriveFORWARD NCFDC and got part of that, and it was just phenomenal because I can't tell you how many people want to talk about startups and helping startups and pushing startups forward and supporting early stage. You'll hear early stage a lot in what people do and what they support. But then a lot of those early stage that they talk about, what they say, where's your customer attraction? And to Braden's point earlier of not having, the med tech world, it's a long runway. And so it's tough to get that sort of benchmark of showing early traction, like customer attraction, to these early stage supporters. And, the thriveFORWARD Fund was instrumental in me being able to continue the company and continue at the rate I've continued. And I don't have scientific evidence on this, but all of that sort of just snowballed. So, more funding comes in, more sort of partnerships and interest from different groups, et cetera, et cetera. And so I think it's just really important to fund early stage startups in Canada. I think that's sort of a current gap. There's some places that do in different ways. I think there could be more, because you got to know that some of them are going to fail, right? Like, it's early stage, like we all know that. However, all of that has added up, to get to your question, Tracy. I know I'm long-winded here. All of that stacks up to adding to your motivation and going, here's your wins. And so our new CTO, Thomas, has done a phenomenal job. One great addition he's done is every Friday there's a Slack message that goes out with like 10 wins for the week. And it's just a reminder, like, yeah, this is a tough week, but here's all the things that we did. And when I look back, I have a list of some of my losses, but I also have a running list of wins too, right? And that weekly thing where he just throws out 10 wins, it really just keeps you going. It keeps you going. And to that point of extreme entrepreneurship, there's a lot of highs and there's a lot of lows. And so you got to keep doing things that will keep the highs coming.
That's fantastic. Will, thanks so much for joining us. I think that's a great way to wrap it up. And I'll tell you what, the list of wins for the week, I think that's getting stolen. I'm going to start using that in my business and my jobs as well. So thank you for that.
Thanks, guys.
We'll be right back after this short break.
NCFDC is located at the Venture 13 Innovation Centre in Cobourg, Ontario, just over an hour east of Toronto. V13 offers a soft landing opportunity for tech startups, flexible co-working space, and event venue. Head to venture13.ca to learn more. That's venture13.ca.
We return to the Frontier Entrepreneurship Podcast with co-hosts Braden Kemp and Tracy Morningstar.
Tracy, the thing that sticks with me more than anything from that conversation is that Will seems like exactly the person that I would want to see in charge of a med tech company. He seems to be really approaching the venture from a place of personal experience and compassion for the patient.
Yeah, exactly. And one of the things that I appreciated was my own experience also having a mother who is a cancer survivor. And when she's dealing with the doctor, we were not always there. So when we were looking for information, we didn't know how to get it because the doctor only talks to the patient. So it would have been really good to have that so that we knew how to care for her. We knew what was important for her. We knew what she needed. She wasn't able to relay that information to the family, and to have an app to be able to do that would have been awesome.
Yeah, the opportunity to be able to connect with that real healthcare data and see those trends as part of the care team that's not medical staff is very exciting.
Yeah, it's going to be beneficial to not only the patients that have language barriers, it's going to help many different people within our demographic here in Canada, just because of the content that it's going to provide.
Yeah, tons of applications. I want to thank Will again for joining us and for the insightful conversation. And thank you, Tracy.
Thank you, Braden.
Please join us next time on the Frontier Entrepreneurship Podcast.
This edition of the Frontier Entrepreneurship Podcast was made possible with the support of FedDev Ontario and the Government of Canada. Special thanks to Victoria Pichler. The executive producer of Frontier Entrepreneurship is Robert Washburn. I'm John Hayden. To find out more, head to our website, ncfdc.ca. That's ncfdc.ca. Thanks for listening.